Johnson Health Center, as you know, was named after a physician who was quite a remarkable gentleman in this community, who was involved not only with providing medical services to the community, but also involved with the whole community development.
Now, we had very limited room. We each had one examining room, and not everyone had office space like we do now. My office was actually the kitchen. So part of my duties was maintaining the coffee pot and making sure that the microwave and coffee pot and Dr. Johnson's heater did not work all at the same time or through the breaker. Dr. Houck was busy being in private practice, running office, trying to keep me straight. And Dr. Adniji was busy getting the practice straight too, getting everything up to par with Centra. Our nurse was Melissa Barber, and she was really good. She had to be nurse to everyone. She was also their lab technician. Marsha Allar, we inherited her with Dr. Johnson in the office, which was wonderful. She was our receptionist, still works with us. So the five of us were quite a busy but very functioning group.
First of all, Johnson Health Center is a community health center, and I've always been interested in community health, somewhere that allows patients to come who have insurance, who don't have insurance, Medicaid, Medicare. It doesn't matter.
After the past 10 years, we're pretty much at a point now where we're going to be able to really move forward into what we hope to be essentially a state-of-the-art medical facility here within Lynchburg.
Well, it evolved out of trying to develop along Fifth Street, following the plan that the city had put in place for Fifth Street. And actually, we were looking at the property across the street, and we were looking to work with both Johnson and with Pace at the time. We looked over here, and this building became available for sale, and so we bought it, and we bought it at the end of we optioned it last year, and we bought it early this year, and C.L. Lewis came in and did the construction, and got, it was a very fast turnaround.
The majority of what the city has been doing is working on the Fifth Street Master Plan, which covers the entire street and 2 blocks on either side, really from Church Street down to the Martin Luther King Jr. Memorial Bridge. And what that plan, which was adopted in 2006, focuses on is really the streetscape improvements that are necessary to help facilitate developments.
In terms of more people, Johnson is expecting 100, most of whom will be new patients in both pediatric and OB, and Pace is expecting 75 at full census.
Because of the fact that our pediatric numbers are growing so fast and crowding out the rest of the facility, it only made good sense, that we would have a separate facility for children.
We're going to have more space now, so we'll be able to handle all the people who are in Lynchburg who are currently not being served and we know are out there not receiving medical care, who desperately need it.
This is going to be, I think, the best children's facility for underinsured children in the state of Virginia. Because we are now the largest clinic in the state for children with Medicaid.
We're drawing from all of Central Virginia to this particular center. So we have patients coming here as far away as Danville to see us here. We are really going to a point where we can have comprehensive primary care services here with the great staff that we have. That's something different from a private primary care service that you have here, in that we not only have the medical providers to see you, but we also have the support staff for the mental health and case management related to that. Also within our system, be able to see a dentist if you need to.
Personally, I think one of the real reasons we're here is for the people who don't have insurance, but if they have insurance, that's great. We take most types of insurance, probably more than most of the offices around here. We take Medicaid, which is real great for the kids. We see a lot of children here. We have some school programs too that we run all through the school year. We see everything from the little 3- and 4-year-old kids at Head Start on through the elementary schools in all the counties, Campbell County, Lynchburg, Amherst County at this point. Takes us most of the school year to get through it, but we go on site and we provide full preventive services for the kids. I'm personally booked into, I think, March. now for appointments. And we do walk-ins on a daily basis pretty much, which is I think that's one of the unique things that we're doing here that I think is really important, because there's nobody else that does that. And we see emergency patients every day. So if it weren't for us, if you have a toothache, I mean, the odds are you're not going to be able to get anywhere for weeks.
If you live here, you can basically have your children who will see you through your prenatal period. They can grow up, our pediatricians can see them, and also our doctors can see you all the way through your adult years and retirement years. So it'll be complete primary care services right here.
Anybody walking in the door can expect to receive the highest quality care that they would receive at any other medical center within this country. We are all practicing first-line, up-to-date medicine, and it's available and accessible because of the internet and the availability of resources to anybody at the point of care. I can pull up the latest guidelines to anything, essentially, while I'm in the exam room with the patient through our EMR and with my laptop there. So without ever having to go to a textbook, without ever having to make a phone call, I can hopefully identify the best level of care for that patient at that time, every time.
We don't like to think of the kids just waiting on the doctor. We like to think of them learning, entertaining themselves, socializing, and that's in addition to the mothers who will be sitting around and doing the same thing. And they will have DVDs, and they will have educational things that they can read about their health. We'll have a teenage area in the waiting room to separate the teenagers from the active kids that are playing around. That's why we're calling it the action room, because it's more than just a place to sit and wait on the doctor.
We are looking at putting in a pharmacy service here so that when you come here and you see a doctor and you get a prescription, you can get that prescription filled here before you go home. So you can come here, see a doctor, get your prescription filled, and you don't need to go to stop at another pharmacy on your way home to get your prescriptions filled. This is to make it easier for any of our patients who come in to see a medical provider, to make it convenient for them. So it's a one-stop shop so that you have a whole continuum of care. It's easier for us to follow how you're doing with your medications. It's easier for the doctors to change something if they need to, because everything will be provided to you when you come in here. And that's something new that we're looking to provide.
The population is different. It's a community health center, but it's the type of population that I've always wanted to treat. And the facilities here, the number of providers here are very impressive, especially as far as community health centers go. They really do try to serve their patients, and they have the facilities to do so, and they're growing. And it's a place that I figured I would be able to start my career and continue to grow here.